brabechie. Now put on a bit my GFs, how you move. Yeah, coronavirus, Larry. Yeah, dear, what dear, yeah, what dear, son. It didn't get in a copy. A giant, your son, in a year. That's soon in a year. That's so Saubamua. Betuma ye enti sare okana maiso ye free ya riwo imwa sawa moya eja ye bu afosa kana magina risufremo kaye nyaba yesu ebradi nachi ye free ya mani eja wakano osemuse Samima wabomidi wo suono Osafri wakwa mboni wo Obamiera dinchaya Eni ewu yewu ansu Ube free through na wati yeye Wasa ya sasinu ya rie Itina gara mani na risufre wi Yesafa nani na risufre wo Ye radie Eja kaye Naji free yari waymo ye way kaye yaba yesu ebrade Naji free yamani ye way kaye yaba yesu ebrade Naji free yamani
Yo, it's here for the for you. Hopefully, live radio no asugusu with you know. Nyamisha so when ya bre abeke ho na yenyina ye besua de. Meaning say coronavirus niti yenyina ya boto. MCCCA na omampani Kuffour ekasaye iti yemudodo na ya boto. Ye hu said ye oman no echo. Nyamie ya dom you and your health jumadi no and now see your doctor. Kuffour Manu ewo ha a oni ebedin komo adofo medical joining in nyamisha titu Dr. Grace Dr. Conde Grace nyamisha. God bless you for joining the program. Nowadays you are always alert as soon as we hit on you and your health, then you're on. God bless you and God bless you for the services that you provided. Mr. FK Mesa Obapa Miniaba Agnes Ajamai Munyina Nyamisham. Adofo Modika Benina Nyame Enshamo and any doctor ewo ha yebedi jumano na ombe cheche and then no se COVID-19. What have you learned so far? Yare wo ya obesra yempeni e de ne yesua fa ho so far. Eno na doctor ni yebedi e ho nkomo etitamu kuchu metwa me ho aba na makofa doctor na enenso di nyame ahyehyɛ amaye no wo dia brain Advent Voices or see already kayen dia ba yesu
Emma womanina eti kayem ratuno yene kayemu yeno tini wire sansa no wakana maswe ye free ye free yeso asawa moya eja yebu afosa Abadu maya kuya kutujani Isu afosa brabechie Na ukuto na bit maji efisa how you Yeah, coronavirus yari Yede wadi ya wadi asa Edim diye na kopim
Yo Dr. Mbajote minka
Mitonka pa DJ utemenka.
Dr. Mitonka yedi nyamiase se enesuso wa me yakwanya eti Dr. Vera mencha ho wa mapanya kasa wie de na de aduru ye beja ma doctor na de wo ho no so odi abrayin
Yo and me da si bebre DJ ejidi for me da mo nyina ase say nyumre so ma be hia ye be dwene ya pom de ho asem ansa ne ye be hia ase no mo me mompai erade ye da wase so ahwe ye nyina ye so aboye ho ba bi disabre it's also better more boy bra ye be dwene ye pom de ho asem be boa ne nsem ma meka nyina erade etumi aboa fofo me da wase wadom nti amen
amen
and then no coronavirus so what have we learned so far? Remember the statistics as of a day. numbers when we pull it up, no, and say I was probably say be an hour. In so don't hold me to those numbers. They say, you know, over 2 million in the way we are seeing, and yes, our coronavirus, yeah, now America has a nipa be 690,000 plus, and then cases of coronavirus, and over 35,000, and so far on. But out of that nipa way, the brain so why they are recovered braye casting. Nipa more than over 50,000 and I recover omukufi. And let me share Sinai Hospital in New York. No. Nipa oma recover Hong Kong over 3,000, bear 3,500 as is omukufi. Into although I really kum nipa no, at the same time, we no so recover. To me, I call back to omufi no or more live it, or more life back to normal. The freeze the coronavirus nearby and near my be as a scientist, or my research and near my be and near my be there is more updates ever coronavirus, so. Do you want to near more who and say, no winning dada, the coronavirus, the idea never what dada. Now, coronavirus, the entire friend of a definition of corona, no, I see a crown like spikes. Antivirus, no, and the surface, the sure no, and what spikes are, I say, crown. I say, I think, so I was a friend of corona. No. Now, there were 4 main types of that coronavirus. You were alpha, you were beta, you were gamma, you were delta. Now, human coronavirus, the first one who pan a bear 1960, and one who human coronavirus. Now, there were 7 coronaviruses that it may infected Nipa. A BN 229E, and no alpha coronavirus. Yes, our NL63, and no alpha coronavirus. Your OC43, and no beta coronavirus. And your HKU1, and no beta coronavirus. The human coronavirus, be so no. MERS, COV, COV, and no beta coronavirus or who Middle East, and no they associated with the Middle East respiratory syndrome, and MERS. And one more SARS-CoV, and no beta coronavirus, and no cause acute respiratory syndrome, no, which is SARS. You sure you one cano. And here was SARS-CoV-2, and only the novel coronavirus now causes our coronavirus disease, which is the COVID-19, and I say coronavirus disease 2019, just because it came in 2019, and no any friend is on the COVID-19. And nipa what we are seeing now, nipa be brave or honomwa. Oh my, your friend is saying I infected in the past with coronavirus 222-9E, 229E, and that's the NL63, and that's the OC43, no, and that's the HKU1 in the past. Now, coronavirus also no, it may affect M1. So when they affect M1, it may evolve it now by the money pounds why they ayari. And to say infect M1 never more. And your friend of the new human coronavirus. I don't think your friend is sad because coronavirus is infecting one and can say one it's now, but the moment if a movie about the now say no about a new human coronavirus. Into 3 recent examples of new human coronavirus. I know one more bad community for the new human no, and no any COVID is 2019 no COVID no coronavirus no. And only you say cause COVID-19 no. You was SARS and also SARS coronavirus and you were MERS coronavirus also you day e wo no. Now they say do you know say a lot of research no. You who say coronavirus, so you say a very deadly disease. Now, a infected and your lungs don't go. Can you know what lungs don't go? But the coronavirus no echo woody fed you no more. Now, I could take it over. You will be our proteins. I would want to win them dream. I think in our media AD. Now, coronavirus, you call one, I could take it over proteins, you know. I could take it over proteins, and now I take it over our entire body system. Mean I take it over immune system, and no any idea. In the only best affected with lungs. They so about who say it to me affected with stomach lining, no, it to me affected with liver, and with heart. No, my gene cryom, they be to me affected with kidneys and cross why they at home. If the coronavirus that causes inflammation, and nunti no try some use hydrochloroquine together with azithromycin no, to reduce the amount of inflammation na coronavirus no yede air cause here. Enti mama sa brainy and oh of course nipa enya yare no do so mo mewu do so but curve no yede air flatten. You know, so scientists call a curve flattener. This is what it means. It doesn't mean say nipa ewu no eyede ekofom. No. Ekrofo mu no omoda suwu. And therefore no the curve is still going to go up. But the number of cases are ebe no and they low. And no until the curve ni look is air flatten no because the number of cases you have no ekofom. So it flattens the curve, but the number of deaths no has not gone down. Because cases now when you're coronavirus, some of them will surely die. And if they die, the curve is going to go up in terms of death rate, not in terms of new cases, but in terms of death rate. It moves so much that TV stuff, so the curve is flattened, the curve is flattened. It doesn't mean the coronavirus was already air copper. That's not what it means. Statistically, what it means, and they say, yes, of course, cases near them, the ABA endorse. And noontin amana is air flatten because you got cases for endorse so old cases maybe and so because the old cases are there no some of these old cases can die and when they die no the death rate no will definitely shoot up based on nipo maide or mewu. So I hope so far getting clear because we are sure so the curve is flattening to we are no more in the worst situation but we are because scientists are predicting that summer, we will have a new wave of coronavirus, especially with all these states. They say you better try to reduce your restrictions. So you better be beaches. As a matter of fact, Texas and Florida are thinking of opening their beaches and their parks next week, which may be a disaster. I think it may be a disaster because keep in mind the coronavirus is almost when you say nipa bebre home is symptomatic, meaning say nipa kono or exhibit symptoms to be cough, no sneeze, no headache, no any your friend is saying fever, no so but the pakoni a carrier of the coronavirus. So therefore that person can infect someone without even knowing so or no crowd or coronavirus until they are testing the pakono or no onim. Mimam a very good case study here. Papa Bia, near call sorry, baby, I never first year sorry, a black American sorry, Papa Bia near the call sorry. Papa ni emergency room physician. Ne papa di 99. Papa ne to Florida. Into Ohio bi a oyede. Ohwe ne papa ne mano. Ni papa di 2 kwan. Into 2 kwan no our buy no frɛ papa no. Na papa ne kan say e ma on kwa ne papa di fie ho no. Kofim so wa quarantine ho for 14 days. After 14 days on kwa ne test no ansa na wa de wa kwa ne papa no ho. Into ope obi fofra no ohwe ne papa no. Mama ni tina ni 14 days one baby. After 14 days of what testing, she was positive for coronavirus. And so mama she didn't have any symptoms. 87 papa ne man Kuffour ne papa na wedi 99 and KB ne papa 99 is everywhere they go because I know you're older with comorbidities. So and into the fact that someone is walking around without any signs and symptoms, it does not mean that the person doesn't have the coronavirus. And no, the coronavirus no day, very deadly. The coronavirus is very deadly. They say, I see and kaufi eja atom. Na bra ufi eja atom. Na kawa sprinkler system. Na eja ne sasi no. Obia babe turn was sprinkler system ne off. Na kawa fire extinguishers. No obia babe 2 to 5 extinguishers in them got tuning in every one. Now at the same time, the Sadi Vakro Bay side was she kerosene a good janum. Ne jana sasi and they derek. Sana coronavirus this year. So when it enters your body, it starts doing damage. It turns off systems that anchor ordinarily, combat fighting against that particular virus, what turning off systems. So it is our systems seem to be near Juma. Said there was some to be here Juma, so that one combat protecting with body from virus. So almost to be near Juma to the full capacity. And at the same time, virus new can also attack organs. He said will be a fair share crazy in a Janoson. Now Derek. Now say I difficult set organs to crabbing every to me are fighting. And noon tin and crofoni be waha, almost disease here so severe, they put them in an induced coma. Now or what tries to move to me and supporting or more organs. No more taking care of what is going on within the organs and the body and try to help the person to build back. Now say kakra you're winning off the ventilator, not induced coma and you never said they be a bit me a treated. Now say why are they where to me a bessie. So that is what the coronavirus can do to you. I hope say it clear in terms of bringing it home, because me try idea, yeah, na me say be used to everyday examples. Now I'm to be a day at the idea for also who with the coronavirus, say new coronavirus, yeah, be cause COVID-19. No, nipa de bebre home recover. One more say area, but about building antibodies. But the problem, let's say, you need any testing to find out if these people have truly built antibodies against coronavirus. No, cause COVID-19. We don't know. They are still trying to find an antibody on be used to test. But who say some of these people can be reinfected again. So being coronavirus that's COVID and therefore cause COVID-19 on to me a reinfection bill. But say near my out studies near about it, let's say those people could be reinfected again. Meaning say a coronavirus, it sits dormant, now relaxing. Ne drew baby na bibi ko trigger no, it could probably cause reinfection. And I say I won't know exposed to someone who has the coronavirus, which causes COVID-19, also could be reinfected again. So that is something that is out there. They are working on. They've seen some cases of people who have been reinfected. And as I say, so idea about they said there are over 334 clinical trials across the United States of America and in some other European countries. I think it will be a race to find a cure. If we say measles, you have a vaccine for measles. Rubella, you have a vaccine for rubella. Polio, you have a vaccine. Chicken pox, you have a vaccine. Pneumonia, you have a vaccine. HPV, you have a vaccine. So coronavirus with the new vaccine and the new antiviral, a dry bit with the amount, I be a bit to me as well. It is our clinical trials to be brave. Our more try some better say vaccine a bit to me a day. As I just always have problem. In Kuffour when your coronavirus not over recover now. They are looking to see say you bet to me a funny pakwana plasma no. Now you sue as research to find a vaccine. You bet to me the one Kuffour. Now day to me a build the immunity. And also it's currently in the works. They are looking into it. So 334 clinical trials make a huasini. If you are still the our lab. One more year research, no more share results of Ubega, and then from there, on be moving into human beings. Say Chrome has said, no, will be our more chance here, our more testy a winnie passo. Regeneron Pharmaceuticals will say, or more yibi, our more chance, or more testy a winnie passo. Once again, let me go back about Africa. It's right here. If you know my chance here, testing one was Seattle, Washington. If you know me all over the United States, I hear more injections, no more clinical trials, here more a drug, no more chance here. Actually, say, is it going to work? No more collecting data, no more taking it from there. But as some way patient with a scientist, as some way very patient with the medical community, because our brain and yet they are on between a draw immediately. It may go into 2021 and Sakra no when your vaccine. As studies the Food and Drug Administration for I'm almost very review documenting any data no more who say is this good or is it not good? And it takes a long time to get all of these things into the field. Into Munya Botre, Emma and Kuffour Sabrino, or more yes, Juman said, be or move to me up while my day, yet to me any baby at Ebebois. I dear Kuffour say so more so you probably be contact tracing. Contact tracing any day. In the answer said, Obi and your coronavirus, I lead you to COVID-19. They are testing in you. You're testing your results now. Or maybe be a friend of contact tracing, meaning so Omu go back to the last 14 days. Nipa chrono in Kuffour or no munya contact. Into Obebu sa nipa chrono, utu quite call baby. And I say, if I now call you, Nipa Bay now you may interact here. Nipa say now you may interact so far. Said if you'll bet me a go back, no matter test this uncle for no Friday. I say, I'm making sure the woman so no, or when you coronavirus. And I say, do they have it? And therefore, no, do they need to quarantine themselves? It's here you hear that word thrown out a lot. Contact tracing. That's exactly what it means. They have to go back 14 days to see who you interacted within the last 14 days. They are testing almost also. That is here, making sure that if that person has it, guidelines in terms of how to take care of themselves. Now, so you also so quarantine for 14 days as well. Now, so contact tracing, no, and yes, maybe now you're in close contact with them. Anyone that you were in contact with, even for about 9 feet, they are going to find out. If you don't remember, you're okay, but they will ask you. If I'm not calling, sorry, them. Grocery store. Grocery stores based on our day. We call you. So, and I say your friend is saying, we call clinic. Clinic bay now call you. So when I'll call testing site then I'll call you, and that will help them to go back into they are walking into your steps in the last 14 days to find out who you're in contact with. I dear back also they saw more kind of say a bus the area when you fever. And now when your headache and your idea won't fall, now for so fair dry, then for ibuprofen. And now anything that belongs to the ibuprofen family to say Advil. And now say men fat your friends are anti-inflammatory medications. Because what we say in Bruno, aggravated aggravated virus. A cause virus aggravated it might create more problems. I'm a woody panel. It is a fever and now say this I will see paiwa. I will recommend this for Tylenol and now say any acetaminophen medication and no more better. Do not take ibuprofen family and now say anti-inflammatory in row because and now say steroids because it may cause you problems. Remember some say Tylenol saying it so far. Ni age na our doctor be ebe can't intimate won't follow my doctor instructions in terms of how many tablets I will be to me after. And cause all problems later on because guy who say, "Ufa Tylenol crab be man broswa and no bet me affect your organs near day." Miss Rema Momobadi and Amunti, the medical professional snaker, and the scientist snaker. If we said you almost can do not listen to the politicians. Yes, I know. We record them say, well, now your president Kasai, Ghana President Kasai and Jay. Yes, it's fine. Meaning say scientists know every few warm. But the first-hand information is coming from the scientists and not the politicians. If the politicians be based on all cultural, so you use chloroquine, hydrochloroquine, and in for more coronavirus area. It's in the preliminary stages. After you know more try we do a quiet bit me a bebwa and yadia and written down say. FDA has accepted, so you know what, this actually gets rid of the virus. We're going to use it, Debbie. It's in the preliminary stages. That's your research that's the bank for get effective baby. It to be a one call for so it's a very careful. Sabri state of Maryland, the state of Maryland is almost will be always on TV. You have to wear a mask. Yeah, state of Maryland, there is one mask. Let's see who. So what's the abonti mask walk a grocery store. And also for doctor's office one share mask. You bet you near the what for 1 year. Near far sign a certain amount of money. And no, it is out the state of Maryland. I would say you hearing me at the sound of my voice. I would say, dear governor, not coming see you. Because when now would you wait in years so maybe share mask. Now I mean to me, the share mask and I'm home here. See a show the near the Okotum there. I hope so which me a home because prison one of the a space is very, very enclosed. Into the Sramwa, the Akano, and all of the states, and Mraya, they are to a governor, said you waka, some among Quabonte, Ubaqabonte, be a grocery store, a walk call doctor's office, and now say the Alcoconantia, Mummy and Tia, do a de or Mokache, Mummy and G of which ye, million, Mummy and very careful. Meaning said Texas and Florida, and for fast as your protest they are, and now no protest they are. Nipa Bebro, Jomo Shema. Almost freedom is the idea. I can guarantee you that if I do a very reacting, they find out. I'm sure that the majority of them will probably test positive for coronavirus just because they almost feel so they have rights. So we were rights. Now why are you responsible for the rights? Now why taking account? Why are you accountable for those rights? Now we use rights no foolishly, dear. Can who say there are consequences related to that particular right now? We'll know exhibit at that point in time. It's going to be very careful in terms of what's going on. Coronavirus, as we say, do you know who NSA? We lose a sense of smell and taste. You can lose your sense of smell and taste. And no, usually, some of those initial signs, and who said there is something very wrong. And you know who's about 30% of them on be lose almost sense of smell and taste. No, they may not get it so soon. Maybe a better pa and son of that sense of smell and taste day. Abba. And no to normal can't say if here pass about free and sabi if here see a bit taking precautions. That precautions being the same. Share gloves. Now come if I say yes, our demonstration each remo. Ain't you know, now you see let's say DJ call break it by mesh remo. So all the gloves are now we gloves now. A quiet our because all be gloves so now won't contaminate one. So the mask so now we a quiet our because all be now won't contaminate mask no because it wouldn't be a one side with the mask no into make sure how to put on your gloves, how to remove the gloves, how to put on your mask, and how to remove your mask as well. Because these are near my share a bit. And therefore, for any practices of social distancing. Into when you obey it, let's say if I call your coronavirus now, making sure that you quarantine the person. So move to me and if I quarantine a dying back, the more maybe I would need that space now. You need to find a dedicated space for this person. So if it means to send if I call a bedroom, now more living room, that's the best thing. Now say so no money share utensils into plate and if I can't be him, actually and if I can't be the cup and if I can't be no. In if I will use it is a move to me, I will use disposable utensils and many pacono. Plate a move to me, would you do want me to me at actually? Actually, say kindness and any disposable cups. Move to me at tuning in actually they are set plastic bag much on my day. To actually. At the whole front, if I call so bathroom will use one. So we bet to me, I don't share the same bathroom with the person. But so we need choice. Yes, I will share a bathroom with the person. So I did I'll bet to me and say, so if I call you via Uber wash your gloves, we were cleaning a whole with disinfectant. So we were Clorox. Your friend is saying, we were Lysol, this Sanya man was saying, so wouldn't be because they say it Sanya man why it. We bet to me for bleach. We bet to me for 1/4 cup of bleach. Now after 3 cups of insuo, no way she now with a good spray bottle. Now so what Dettol be able to be the catcher, we need Dettol so what chim lemon a day a couple. Not mixing. They use so I would say now the seminar so crack out a now we're used to as your cleaning disinfectant, it will see the prepare for one our whole toilet to numu and the bathtub in the sink no. We are now saying web sprays are the paper a honeymoon disinfecting honeymoon and son of the next person I day to me a use. I say soon if a chronos a toilet room will use of we'll make sure that if I want a dedicated toilet room and I'm also more dedicated toilet room. Time will be and if I want to bet in a toilet, no where you should be. The next person will be only coronavirus. Make sure that you put it on gloves and cleaning that place thoroughly. And son, why they what I could use to. Idea banana, idea for Francois Banese. More yet further research looking into it as well. And it's a one more who say, coronavirus, we know it may appear in obese stool. Stool, no, that means your poop, no. The virus may be in your stool. And yeah, conclusive. They're still doing research on it. And no more culture was there. So when you will be will be. Now, bathroom, when you use the same toilet, take those measures. And another thing, some of me and Kai who say, you may be living with someone who has it, but you don't know the person does, and know to take precautions. Be a bathroom, will be obey. But what they are not, so when you know money, the last person there should clean it. So that the next person going can use it, and then that person can clean it as well. A safety precaution, I'm more than more taking. A bit to me, I say. When you coronavirus maybe what me test so you test we ya can't just you to be into hospital now can manage COVID-19 symptoms the will see and near my best now be to me I will kufia and was so making sure so be stay with you won't quite you my Mr. especially you free baby by any idea so and was semi quite you my dear any however and so witness ye men quite you men sorry say will call on tia nante men sorry so will call grocery store. Please stay inside and get it onto public transportation and our taxi and our DBR. Monitor our symptoms with you. Check it with temperature. It is our temperature. We will say 100.4. Making sure that you're calling your doctor. You will be doctor and what you need to do. So the bear doctor in terms of what you have to do. But what they are never to be brave. Na hydrate. What does it mean by hydration? Fluids. warm fluid, soup, any idea, any ensure, any juices. I bet me a boil be brave. I therefore also I'll bet me any several doctor. So right now temperature near costo, it could chat 100.4 no one. For what you are doctor, they are appointment no corner wound to be show. Say emergency do baby now wound to be home here. Friend 911 said they be on between the above 4 for normal taking care. So I say so power now when see but what they use to tissue to cover your nose when you sneeze, to cover your mouth when you cough. We are touching it. Now one fat a idea here palm. And so one fat so many times. One son use to seminar any warm water and your hot water. Seminar any warm water. That says to say yeah. Oh, Abontina, oh, baby, just so happens if I walk out doctor's office. Now, if you went to me and call bathroom, or hands and sanitizer, making sure to the ear ones, and know the alcohol content should be about 60% into the same one when you're in the as much as possible, no. So when they were pushing your phone, you know, and TCA back home. Now, my friend is saying when you're COVID-19, normally manage your symptoms at home, but make sure say you are staying in one room by yourself. Said if you are exposed, you are more to that particular virus. Now says won't go in and out. Say they are now food them they have to send your food and everything to you in that particular room and quarantine you in there for 14 days. Say about to be PF with them and you make sure so wash your mask. Said if you are exposed, you will be alright. Now I say wash your mask and over said if they are one found sounds like a can man cause the problem. I say so more money send if I quantity and more body and some big cleaning. If your surface is no more refrigerator, stainless steel refrigerator, microwaves, stove tops, countertops, toilet, condom, door knobs, any fanny and with a yiname kind, who's a mammo. So we need disinfectant to be able to me for Clorox, any issue, any seminar. That is the way you should get concussion and the cleaning with you. My candidate said do not share household items to say utensils when they are no. If I can also when you dedicated items on one is seminal DJary, on one is toothpaste, the toothbrush and you're exposed. So if you shouldn't see we are on fancy toothbrush holder and kata hole. Your friend is saying toilet roll, any idea, you know, I'm making sure that if I can one dedicated items. Towel or DJary any idea, I'm making sure that if I can on one dedicated items are all use so uncle from what day. My car already about using your friend says cleaning surfaces as well. Before doctor, for mommy and Sebi, or me a ER physician, Ghana and Iba Cook, your friend and Nefua. On my launch, your friend is saying telehealth service to be. I have fancy if you have questions about coronavirus and the idea, you can actually call them. It's a free service, and the idea will be in order to get it. I say so more students, so you can actually volunteer with services. If you have okay, may you volunteer now. If you will be go through crisis and will be, are you all worried about the coronavirus test and the idea? Or more train you, no mama guidelines. Into more muko school, no, if you will pay with student loan, no, or make you about $5,000 to pay off your student loan if you volunteer a certain number of hours. Say if you won't go school, so now we person volunteer, we bet you volunteer with services, or bet you about 2,500. Now they are two savings accounts. Into DJ. Let's say nature at the end picture. Number text yeah, bro. Said be I would be available. Now for be to me a cohonom. No more click your website so no more volunteer. And therefore problem who coronavirus so far of what we have learned and so say cause a lot of at a tier would be breeze. So anxiety, depression, and the panic and would be breeze. So in your country, you know, you reduce the amount of information we are getting. No, say as a news now we shouldn't be brave constantly. The news station, social news now cause the anxiety and panic attacks. And the news station, they do something else. Find a book to read. Spend time with your family. Do something else instead of spending time. Most of them call WhatsApp University. No, mesra mo ase sabre no. Mon cancel mo enrollment. Our WhatsApp University. Because the web will be brief. It's a WhatsApp University, no, and my information be brief. So information 99% is also no a garbage and no correct. And so people are spending their time on WhatsApp University, getting all of this information and using some of these things and yadia a proven say a no correct. Says I didn't be to me up wow. Into Miss Ramo WhatsApp University, no, Miss Ramo enrollment, no, says I bring your bra. If you need to cancel your enrollment until such a time, be a coronavirus nebeko. na mo assign day akoko bio. Ti mesremo your intake of social media and also so can have a negative effect on you, can cause anxiety and can cause a lot of panic and a lot of depression. Nipa bebree so lose so almost at this point in time, especially almost savings account and now almost 401k or retirement account. Akoko because the stock market has not been doing well. But last week the stock market did very well. On Friday, the Dow closed at a very high rate. And my idea is that man how be of course we say it's difficult, but find a way to cope, exercise, spend time with your family, connect with other people via your friends using technology. You will Zoom, ubetumi a FaceTime, and I'll betumi a Skype. Now you will be a kasa, and you betumi a call me one down. Meaning I'm so feel so there's something wrong with you. For our doctor, nebus our doctor, nama our doctor, Emma the right diagnosis. Emma or doctor mouth the right protocol treatment, unsure the right treatment. Instead, top our young could be our only healthcare background. The annual country also, oh, me no sobolono, me virus no call. Meanwhile, you don't know if that person even had COVID-19. And what proof does that person have? Say no COVID-19 or no sobolo, a coy, and you're not correct. And also, me reassess me de fly and chadi and me de ring, tiane prepare fry, you know, me no me nini na ako. Another caution I made the member say, yeah, baby drone, and you're good. Men can't say and yet. The only problem is that we don't know the right dose to use. And it's not tested for currently what is going on. And I think so be or for bronier drew. No, I saw a fair baby drew na kaho. Wouldn't interaction sa a baby drew no any bronier drew ne bed e benya negative interaction. Into mummy very, very careful. So be a best piano. Mummy musa your primary care physician and now so a healthcare professional. Busan is our question and son which one I'm also busy. Once again, I'm stressing again. Your friend is saying University of what's happening. Mummy and Mama Diani and the so. I think so idea about what you say. If it's a coronavirus buying, the Masha essential your friend is saying businesses are you know. Liquor business and conform to liquor no. One who solve your essential business. Still one will be, and I'm surprised to say none of these governors said, so you know what, every liquor store should be shut down during this time period. Because I don't think that liquor store is an essential business. It is not. And so liquor stores in Airbnb, the Omo who know the for sorry, Omo to ensa any idea one more num and yasan kitwa into a blue hard alcoholic dada and sana coronavirus fever. But it's not any pakoni year, you know, ya quite no one sabebre and morobebre. But they say if I call a into just say and san one of my war bro. I want to cause the problems. Into Tremo, more AB a monomonsano, won't cut it down with intake of insasabri, said a bear and cause a health problem after coronavirus needing airco. Madame was Sibibre, Madame Manu CDJ. May assure them for 4 questions.
Yo, doctor, you better was
yeah. Okay. Yeah.
yes, sir. This is on Kai and the Abba, son, and I know a ding, not on one cassa on Kai. Nyamisha send the Paduana joining program no and ne more mobile in Nyamisha. I mean, about Faustina, right? Emmanuel Osei all the way from Ghana, Nyamisha say, what joining a Jumadian so and then Maba.
Yeah. And so it also. Okay. DJ make it I'll be to me I share with Obia why with the Nipa Omo I said why. No. Yo. Okay. My main plan no my boy. Why? All right. Into gloves. I already pa. Into gloves no. Some will be any said you see gloves in the end. I don't have to show you.
Yeah.
Into we shower gloves. We shower gloves. May share me gloves instead of they are. Let's them what they na can.
Perfect.
To we shower gloves. We are. Who person will you with gloves? Some women say.
Doctor, your home son.
Into we saw what the one say we no. I saw gloves no more. I saw gloves. I couldn't see. So that way. Who said he? Who said he? What was the sun coming so?
That's right.
Okay. Now, that's that. Your friend is saying, "Man, sorry." Okay. I'm taking these other gloves off, right? This off, and put it inside the other one.
Inside the old one.
Right. And then you take it, and then you throw it away.
Wow.
See that? You take it and you throw it away. But it's only hole, and then you throw it away. It's also glove What's your glove naturally? Your hands are clean. What mask now? What they say, you know? It's your time so what mask to say ya. Oh, and we're N95. It's all mask we be. What the mask can I say, right? Oh, okay. What the mask I say? Make sure it's on tight, right? When you will gloves navy, you don't want to hold the front of the mask. You want to hold these. Okay? All right? And you remove it. If you remove it, also you've not touched the front of the mask or the inside of the mask because you don't want to transfer anything there. Okay. Keep in mind, so when you touch the front, and maybe there's something on the front, yes, I'll carbon thing, will be a when see a good mask and then say, all right? What touch it? What touch it when him? What touch it when you're now when I'm baby? You transferred anything on there into you. Into your no. Maybe the other mask and hold on. Excuse me. Into the other one. Hey, this type of mask. This is how you put it on. Okay. All right. Mhm. So here DJ almost said the mask and I said, right? I said, ye. I can't say my back. The tie mask, I'm just gonna take it off now from the top. Oh, and yes, yeah, so dear, all right. I'm holding on to this. I don't know. I mean, so I didn't know. And that's it. I took it off. And then that way, my papa home. Yeah, my papa home. Say a mask, ube to me at watching here. Now, what extra mask, you can throw it away. And so a mask, I want to be in touch and I'll be to me a year. No way, we're reused. Now, caution, I mean, the mom when they say, oh, especially gloves, no. You got to bring over gloves, no. Well, yeah, no, but so a Sunday day, actually, care when was there, you so. No, we use gloves now. Throw the gloves away. Then you a mask. That's how a hand sanitizer use the hand sanitizer and the fire one fat. So there be a one Saturday day. What sanitizer one thing and the coffee. Who could do for now mask? No person see and we see. Then soon see that our church then you throw it away. That can't show someone keep his Ziploc bag. We use gloves no. There be any while between the gloves by the atto. We use Ziploc bag and now the gloves not him. No one's the piano. So there be a wood roof here will be to me the atto actually. Let's remember. Almost do who say a cost on the same. And Kuffour to two gloves the day, a good form. Our grocery stores and Nimu, and a doctor's office and Nimu near dear, me pamo show. Ma want the two gloves in good form. Per trash can never go, trash can in Niwa. Keep a lot of Ziploc bags that will come. They the fag gloves be good. So they be a would drew the right place that you can dispose of it. I hope say it clear, Madam Watson.
Yo, doctor, yeah, that's it. I'm say watch it, you may but you'll be testing me, meaning say, Mohana sound and then ya na say, Mama me who see be a problem or no man. Now you're taking care of that. Doctor, no, Obi Busa say that second one now, what they say, a reusable because I'm the first one in
and you're reusable. Way second one way no, and yes, and you're reusable. Into way that you can throw it away. Way say no.
You can throw it away.
Aye, when you're reusable. Right.
Okay. Doctor, that's it. And when you are saying, what's you any day, when you it's a China made, we are with me to say, when I was saying, not offer Kuffour. Yeah.
And you know more recommended that yenye and toma mask, because and toma DNA, we are cloth mask, we are you can wash it and then reuse it, and know you're easier. So instead of having these and having to throw them away every time, cloth mask you can reuse it. And after you can wash it and reuse it.
Yo, Doctor Edasi. Okay. Obviously, okay, people put a small garbage bag in their cars. Mama, I know this way.
And you're very good. So a small garbage bag will come. You good. You bet me the way you know. So they are true baby, between a year watching. The portion of the day, Mamma, Mamma, too, because the baby was so I put the side and was so I got to be so now Papa be South Africa. And we could make a Mamma told you the problem. You need to put it in the trash can.
Yo, Doctor, Indasi. Doctor, where's the studio? Say, Doctor, well, Doctor, my close relative had a COVID-19. A friend asked me if he had the symptoms or the disease. What are the differences? What are the differences? My name is a question is on the okay. My name is
I think the symptoms of coronavirus, COVID-19. Let me just make something clear. Coronavirus causes COVID-19. I hope they are clear because I think that people are very confused. They hear coronavirus and they hear COVID-19 and they're not sure. And to say you what HIV, right? HIV, and they lead to AIDS. So who's that? Does that make sense? And I say flu. Okay, but let me use flu. Your influenza A. And there will be any idea what into A no, and one the best which will lead you to flu, to influenza. Into coronavirus and they're causing COVID-19. I hope that makes sense. Into the symptoms, no, any coughing, sneezing, shortness of breath, headache, fever, diarrhea, nausea, any vomiting. Into symptoms, no. Into that virus, no, and then cause it COVID-19. Coronavirus causes COVID-19. I hope that it makes sense. Because I think some people are confused. Or my just a coronavirus, a day, they know the symptoms a day, and COVID-19 is the symptoms a day. COVID-19, no, the symptoms mark actually, but a coronavirus and they cause it by COVID-19 because the area be an SC money be. From what I say, to say hypertension is which means I say heart disease. Yes, hypertension is a form of heart disease. So a form of heart disease, but you can't just say it's a hypertension is a form of it's a heart disease. A form of heart disease. It is the same thing, no. Coronavirus, you will more who do be pretend and start in the kind. Me mama various examples of coronavirus, no. But that coronavirus, particular one, no, called 2019, no, and then they call it COVID-19. I hope that makes sense. COVID 2019, and they call it. So the same my search room. Mm, 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 hey, yo. Nti almost who say that coronavirus almost who and watch me coronavirus so no the money the money the money pa they na ba be human coronavirus there is a caution am the member mu nyina na say wo ho na bia na wo re bat any saa mo no saa brain ye bra wo kwa akore wo mo let's say bia saa brain wo be moving more to and number a be a bit on the safe side to say fish no more no ne chicken no more salmon and no more berry a say bia obetumi akọ kakra so when no de take obetumi akọ and na point na me obetumi akọ ansa na bia wo de aye aduane a and also be boa bebre ye so si eno aye aduane ma ne che nti ade bi e wom usually e bewu nti mesrem a let's shift to the more safer meat than more focusing on to say meaning say almost a Ghana crank for chick rats every warm right in Sabia, this is not the time to eat those animals. You gear more towards Sabia, fish and chicken, normally dry meat no, to protect ourselves at this point in time.
Doctor, yeah, Doctor
Okay.
Mewaha. I'm saying,
Okay.
why I know my na some little issue. Doctor, we been so the answer. Also, you talk about anxiety, panic, and the stress. How can we stay away from that? Because they say news in any way, you know, and no kwa or okra and any tiania. What is the best thing over to my one dum the fear can you in your man, you know, no someone I say.
Yo, the message I want to say, it was said, Bronica's a consumption. We are consuming too much during this coronavirus period in terms of news and it's animal. And to make it me a cut down on consumption. It doesn't mean that so next year and a new side be a na wheat, na cliscomo candidate, na lemon so candidate, na Anderson Cooper back, na Dr. Fauci basso, na Trump and the pen suit to take a move there be Mr. Ramo. So news they are limited to bare 30 minutes per day. Because after all, they were updated. Obey news so cry. Listen to your local news. Now says to TAB weather, said the weather there day, ABC any idea. And therefore also I'll be to me reduce anxiety, no panic attack, no any depression, any headache, no home corner bano. Find something else to do. Sabre no mask, I a problem. Nipa bebre, my dear pump. Yeah, you free Africa by you don't do any my dear pump. Who bet me use Sabre no cry as I see a pump mask. Now they are healthcare practitioners near there. They say hospitals they break per mask. And you might have be break per mask. Which me use Sabre no crap and pump mask be. Now what box it. Now what first for hospitals and local area. I can't almost say why a mask how they baby say warm. Ukra we di beba news so. And ukra bema will be crowd where who so ukra you do exist. Into an ukra is something positive. Pay people for you volunteer to do something. A be ana emrewane ukra wo neighborhood ukra wo no omo grocery ni adie. You can volunteer with the food bank be ni adie so much be ko fair aduane no. Akosisi wo doorstep no ring doorbell no. You don't have to hand it to them directly. Or ring doorbell or be upon about the father crowd no. So find something else to do. Sabre bra, you can learn something new, a new skill. So ebi ananka pe so sua brofo. Sabre bra betumi akọ online. Nkrofo bebre offer free online classes. I'll betumi ede akọ no akosua new skill. Sabre bra mpa ebi enfan say upe so sua bibi eye. The bake upe so sua say dey si topano. And now upe so sua say dey si meat pie. Upe so sua say dey si cake. Ubetumi afre obi onim sa ade ne ye. That's Abria, your FaceTime, any Zoom, this Ania Mano. Wouldn't if I can't so I'm not sure that yes, Ania Mano. No, she new skill. Which me I can kind books, else wouldn't I can kind which me a throw before I'm not sure any idea. If you do something else, either than listening to the news, so great media, then no, instead of listening to the news, no, find something else to watch. Or more shows to be brave with TV, so comedy shows are. Ubet me a 3 bit me a one reduce to anxiety level. Almost our Ghana movies and the Nigerian movies over Netflix so, and also you can do it. Which we have a Bible parking kind SGA new verses from the Bible. Which we play games with Wabushia for us. Our games it doesn't have to cost you money. They are sure say you free baby Africa by idea. Yeah, I can say we are growing be idea ba. So worry. Ludu, you were damn Which we can answer stories like any idea. It is so and our Bushia and our Nana no man. There's so many other things I'll be to me I occupy our time. And we here so we news. Now we cause so anxiety and a panic and a headache. Mm-hmm. Yeah. Yo. If apart from nsuo, no betumi anom juices so. Na so if say juice, no sugar bebree wom no. The American say if say bi a wonom cranberry juice a, wohwie cranberry juice half a glass a, now the nsuo half a glass so why dey egu. No one nom. Say the be a betumi adilute no. Na sugar content be dey e betumi akopom. Betumi anom fruit juices so. Nipa be obi wo ho a onom orange juice a, na e cause a problem. Nti wa hwe juice a wonom a be dey e betumi aboa. Also, more coconut juice so honum. I know see I never contain them. And also bet me to be a down a bit hydrated so. Into those are some of the things you can do. I dear from so bet me a dianca and car say is your bet me a dianca. I remember whom you be brave. Also, watermelon also contains a lot of water. Into bet me a watermelon also so. A brobe and see a day a honomo. Womo your friend is saying pineapple. No, but a brobe and one pineapple. I think so, right? DJ, right?
Yeah,
Pineapple, right? Okay. Pineapple. Okay, pineapple. And a pawpaw. Which means sweaty pawpaw also and also contain your friend is saying a lot of fluid as well. And therefore also which may smoothie. Say be a wako blueberry, raspberry, and a strawberry. And also so which be the good your friend is saying blend them and now says a juice your friend is saying bullet. And it's our name there, you know, which means now the ice now I blend it. Then also it's a way to hydrate you because ice no a form of water. And we have already a situation. Which is one of tea or more ginger tea or one which me and you want black tea, you want green tea. If you can choose between all of these kind of fluids. And a tea also I recommend say let's say situation so honey or local honey. Now honey no it has to be local honey. It won't be better honey or Maryland. Now it's in Virginia. Wouldn't this honey because it's not going to benefit you. You want honey made by bees who made pollen in your particular state. Because I know the benefit too, because whatever state you live in, your body has adjusted to that particular state. If you also honey, so to Virginia, to locally grown honey with Virginia. Would to DC to locally grown your friend is saying honey, it would DC, Maryland, and I state to be our tiano. And so pay honey and you're local to a particular state. And you can cut down the sugar that way. Honey and natural sugar, which is better.
Wow, Doctor Nyamisha, Me and my brother Emmanuel say, oh, the topic is important at the moment. Keep it up, Doctor Nyami Inshaw. And Doctor, where is it? Since the coronavirus, I stopped eating salad. Instead, I have been eating cooked vegetables. Doctor, and this is where salad so they get him saying can punch the Indian kaya.
You know, you know what?
Corona need
You'll be
to
our preference. Yeah. DJ will be our preference. Obi will what if Sabri was wrong, but will be raw vegetables. It's okay. So a person would do cooked vegetables. Are you okay? The only caution I'll give about cooked vegetables today, and it's a woody you see so Manu who now the vegetables, the two vegetables you are not watching it. Because all the vegetables you see so many you are losing the nutrients. If your idea crack, I recommend the pan is ube steamy vegetables. It would ensure basically so. Now we didn't make a trail good. Now I'm ensure who now this one here ensure no so. And my son here no got ensure no into ensure no put enough to set what this one here too much or you don't got ensure no. Now this one here not too much. No to show vegetables so now the good so you know kata so not steamy vegetables now. And no is the best way to get vegetables with more nutrients than to put the vegetables directly into the water.
Yeah, that's it, Doctor. Minion Louis Costa, all the way from Ghana. Or say, good job, Doctor. Minion our free pharmacy last 2 weeks. Okay. Good job, Doctor. Doctor, where's the question about Yentadi, you know? Was it last time, okay, say, Ufrat Jumaba, Rowentadi, you know, but so was after work, you know, Santa, you know. One thing go for how long? Episode for 3 days, not 3 days, and then what do?
And the 3 days in one second, who said, would you good plastic bags, right? Coronavirus, also, it can stay in plastic, it can stay in clothes, you know, on those kind of material for long periods of time. Upwards of almost even for up to 3 days. And we can make us a fascia bag in the kitchen. Now, after the 3rd day, now, we need to in our corner. No way, washing machine.
Wow.
Now, I dare back so I make caution when it's a more musi way to washing machine. We see a near many ria, but what they are so best sign after that concussion I make kind of Clorox in you and it's a menano. Would you be best spray washing machine when you know what you near many to be spray when you know what paper when you know and sana where you see a DSC or regular and near money. And do the same thing in the dryer. Just clean up the dryer and open up the dryer door. Let it all air dry. Cry and stand away where you see. Because some person won't tie in out the way you want to see. Now I find a regular tie there. You want to disinfect it.
Doctor Mbachani, for way to assume, or you say, a teenager say, we are so auto at ideas, so believe we say, he's what I on a bit marble. And secondly, what a day now become for at this time say our sister, you did a new call laundry.
Yo, it is say dry cleaners. Maybe say me call dry cleaners at Japan since the coronavirus came. They farm a near man called dry cleaners. No one near my baby. I mean, they call Nanka now to be a meko. But they say now kind of held off. And they are me preference. It really depends on who you panel and how comfortable you are. So, person with your car, it's in a while so. Person with the now train everything sees also. And no shoot in a while so. But me, I'm not using dry cleaners at this point in time.
Yeah, Doctor, that's it. Doctor, we're so can social distance. Obi Jay is a hospital or doctors in the nurses, you almost shut down practice. Now, Yankasa, your cohono. It's social distance. What is the best thing that we can do? Baby, no more refi, Max and any normal will be on Mukra, Abia, especially Ghana, will be free if you could be also what him. Oh, what is it to see about the new refi? So, Bibi said, no, ma, is there anywhere I bet me a protect you?
Yo, and the only way to protect yourself, social distance, what I say, you have to stay at least 6 feet away from the person next to you. And to our measures are 6 feet away, no, which is about 6 or 7 steps away from the person. So that you have that space between the two of you and only the kind. Secondly, the country will be as a so we best making sure so with the handkerchief at least near no ever show bag. Now one man show bag, we said be a walk carbon tia. We found bag now they call. Into drop on tea, if you walk now, rip of a mask. It sounds like what handkerchief, a shower bag, no, to me, you know, why day where you sue as something to protect yourself. Into no idea you be to me. You cry a tip from here, cry over to me the handkerchief, as a Ziploc bag. Now they are too okay. Now just a walk on now, refuel mask for cry. Still, no handkerchief now be to me a dear use as a protective shield, as a mask for yourself. Doctors say nurses or more hospital, more practice social distancing. Keep in mind, say, don't do an ash or share mask or such a face shield. So, as I said, head cover, wakatani hunina, and Kuntadi or Machine, they are all protected. And even if they're standing next to each other, still, no, it sounds so whom we on coughing wounds, so no women wounds, so no, they are protected. And a woman, so it's very difficult to practice social distancing in the hospital. Let me give you an example. The doctor have a patient, maybe a nurse, no, damn home. Doctor needs to be in that patient's new room. Emma nurse needs that 6 feet away. Emma doctor needs to get him. And get the nurse, hey, others when I'm there, Manu say, and so there has to be a communication. So they've got to be close together one way or the other. Into almost they are practicing 3 feet away. So that's what they are doing. They're trying as much as possible to practice 3 feet away. And there are certain discussions also more sensitive information. Almost to me and screaming across the hallway to each other. It's weird that they have to be close to each other to discuss some of these sensitive information. It be anything. It be another patient to be not still no, there are other people waiting to be seen. And also I discussed that privately with the nurse. On to mamu amote when you day and see them no. Go back at them so be that's what TM nurse say, hey, this patient is dying, and nurse TM say, hey, this patient died to the doctor. More when you're betting. It causes a lot of anxiety, it causes a lot of stress. It will be possible. And they have to have that communication and to understand them. And now, who calls the doctor on master, you have to request. And now, any healthcare provider, you have to ask them to put on a mask and tell them, say, you don't feel comfortable. And they will put it on. We will show you on the
Wow, Dr. Edasi. I'm saying Ghana for was on Ghana questions more. Was it, Doctor? What about we Africans? What am I talking
Africans, they catch it on South Africa, no more handkerchief. They say they mean say more handkerchief be brave because for a year or Ghana. They say mean say year view. But a year more quality handkerchief for more quality no. So brain and which me use to the best of your ability.
That's right.
I brain a year bra. See handkerchief no. Never show bag, book or show bag. Who carbon tia. Now I they work now they are catao when so we need mask. They say to me they are protected. And they hope I can't show when they say most of our carbon to be fear when Pablo was saying, but what they are say, Ghana the Dettol, which is good. So you see a cracker Dettol, no, never good to remember a tissue, and after whatever you use, the first step on Pablo, no, they one Casasuko Johnny, no wrong when tired in this seat, that they bay a wolf be beyond your day and call them. Yeah, Ghana, and so you be too.
Wow, Dr. Nyamisha. Doctor, another question here by very important. Ghana, the Union Post Office. Open cry, you said, now watch it, and I say, but wait, I say, Doctor, what about the meals? We do touch the meals. I get the meals with gloves and then leave it for days in a paper bag before opening it. Doctor, I had them so explaining my part because also I broached had you Obia mailbox in the fear anymore. And I said, Bonnet, to Obia about baby meals. Postman or the buy and I say let us know free China and Korea and we move on. You know how we are Modeba. Baba drew a Sophia who may box woman so nowadays. It's another so young day.
Yo, into one Ghana, no, we call post office now for June mail. But what the next glove said, if I got a kind of the
problem, so Ghana the open alcohol by Hanum the cabro.
Into more, no dear. Yeah, you say the end, say a shed glove near be a mailbox. No. Near some brown paper bag near the mill in the United action. Near the Ababi, near spray at the end you spray home. No Akata who now they are 200. Now the first about 2 days and now 3 days, no be so. Like this, why the wash out and gloves, who will be a letter singing our so. Now we are what to envelopes in the idea at the United actually. So that's what you can do. You could be your mailbox, don't open it just like that. Put gloves on, take your mail out. Put in a brown paper bag. Who need brown paper bag? They say a plastic bag. The rubber bag will be a grocery or rubber bag when you see. Patch a rubber bag. Never break, you never better. They spray and who you now with concussion and they capture them. Will be to be a spray who you now sprayer. Now they are 2 or 3 days or so. I wash a glove we be so when you were opening in our so we are now what envelopes in action and I say well letters what me happen. So that's another thing you can do.
Wow. Doctor, nyame shop. Doctor, me questions where me come you mum ne yan contem. We say a max na oka no de ya pam no so eno so effect be no and e bi ono ma onye comfortable means bi eni ho. Ha, and the second question say
On your comfortable thing, so be say mask na.
max no ha de ya pam no I think say this is omo pano say bi no the tie and the so the other chair on say we handle but the man made new way ni bebre bi on ma a tie and the so di bi on ma wo sha say a twe so nya comfortable and obi say no and at the center and no so I ntoma no how many times now bet Messi and I say how many times now bet me away because bi no e hande wo omo ka mu ndi otra ka no ma na so osi a no de ase
okay yo the mechanic says our mask na you didn't to my pam no of course and yet N95 mask. So you need to understand, say, and just an N95 mask na very highly protective. However, it still protects you because we are there wakata when it anyone who so when you are properly sealed, and you definitely know you're protecting yourself. Whereby, the maybe you know when chain na me when see never call mask no so when see no enko who so ebe kwa ntoma no so but enko show who enko show wanum. So you're still protected one way or the other. They talk to me, meaning so about the Ghana, the time, but your elastic band, and for my the elastic band. Some okay, maybe mask and the N95 mask, I'm the criminal. Who's the way elastic band? Aha. Until your what the elastic band, I did, also. So, who for Tony say, the over the IS, I hono, one pass. Who bet to me a pocket to elastic band. Now, the above pump and was so honorable. At the back, what I have. Now, what's the back was why the IR see a honor. So that you can be comfortable with it because elastic banding is easier to use. I say so to my dear, the mechanical say, so carbon tea, the emphasis and the walk carbon tea, what do to my mask and I say, Wapa, BC, Brabisi, because we need the aqua as soon as you get home, bra, nebra BC, ne dry, so they be idea to walk, who to me, I say, who me out on to my mask, so they be a woozy way, air dry, no. Now we are there, which me use back on. But I would say every time we be and I'll recommend say we be just because it's not an N95 mask.
Doctor, I see nyame shop COVID-19 de wa ma yesua ade bebre and so we more aka ho nyame insha. Doctor, where so the I say be emfa medication bia but I don't know so migraine no say there. It seems that oteki Tylenol no regularly. Eti eno abasa no de no betima ye wonjai fa anase de no betima ya fa ho since ese money take a drobia
Man kase ban take a drobia me say e mabon fa ibuprofen.
Okay.
And now ibuprofen family of medication. Na say NSAID steroids no money anti-inflammatories no. E mabon fa no because it we aggravate virus no. The enura obetumi afabra wuti pai wa na wo fever no Tylenol anase acetaminophen. It is I draw now between Tylenol anase acetaminophen. But men for ibuprofen, it is Advil no ne idea no they don't recommend that. Or more recommend it Tylenol anase acetaminophen. So for Tylenol there, it's okay.
Wow. Doctor, one thing you Doctor, where's your question is about the contact tracing, no? Also recently, Dr. B in New York interview no when you be no or recover, but all man story that means any roommate or a security officer, and or the buy, but on no way about Doctor Ndie go so good was survival. But with the contact tracing, say security officer and the man just imagine say or entrance be another baby and nipa be brave. Those people are very much tracy.
Yo. Ain't no answer security guard no senko when we are obeka from Abia. Me ye juma wo, I'm just giving a hypothesis. Abia me ye juma wo sa hotel we go into sa hotel ho me ye juma wo April, me ye juma ho February, me ye juma ho March. Na do be so be ko sa hotel ho no more busa enkrofo a bar hotel ho from that point in time. Then that way they can do the contact tracing. That's the only way they can find out and do the contact tracing. Into will be about hotel ho. Sabrina not fast security guard here to the they will contact those people and they will test those people.
Your doctor, that's it. Doctor, when you say what can I say recoveries no omo are recovering any antibodies if I'm right there. I see any antibodies via a help home. Na ebere na obi a wono wa recover wie na na se nyoma be na obetimi adi a ebe ma ne red blood cells no and na se immune system no etimi a fight ya ebi nye ne biem.
Okay, let me just say something. Man, kafta omo ni antibodies. Let's say omo recover from COVID-19 no. Usually so when you build up antibodies. If, for example, when you're chickenpox as a child, you have built antibodies against chickenpox.
Right.
The next time we are exposed to chickenpox, our body has this memory of that particular disease. And you build the defenses against chickenpox. And that's one example. COVID-19, when you're COVID-19, recover. Yes, almost build it, but almost need any test, right? There is a test to check for antibodies for chickenpox, for example, to check for immunity. Yeah, what test which we are used to check it for hepatitis B immunity after you get the vaccine. But COVID-19, you need test. I bet you the check say when your antibodies are now. I hope I know you're clear.
Yes.
It's because we don't have a test, to check for immunity, They're working on an antibody test. As soon as they get it, they will test you to see if you build antibodies. And that test is in the process. Secondly, COVID-19 some of them have been reinfected with the virus again. And also they're trying to figure out how that is possible. So when you're reinfection. So they're working on that as well. They say the obe to me I say when you recover. Your regular fruits and vegetables that you've been eating. Once again, chroma de your fruits, your vegetables be asparagus, beets, your radishes, your color green, your kale. You can eat all of these things so far as your body can tolerate it. Obe to me the carrots. And we are so don't let us limit ourselves. We have a lot of fruits and vegetables. Let us go to the grocery store and get these things and eat. Fruits be brain so your kwadu, your ankai, your apple, your raspberry, your blueberry, your grapes, your strawberry, your and also fruits be brain, your mango, your pawpaw, your pineapple. So you can eat anything so far as your body can tolerate it to build up your immune system.
Wow, Doctor Nyamisha Panemachum. Doctor, other ones on say a liver, any lungs, any organs now body in your neighbor bit media idea amana strong netima fighting.
Well, once again, if you can eat any fruit or vegetable, or vitamins, essential nutrients our body no eat here. So if your body can tolerate them, go ahead and eat them to help your body. That's all.
Wow.
But think about it. The person say it is not a cure to the coronavirus. It's just to boost up your immune system, just to help your body. But the fact that we have a healthy immune system does not mean that you cannot get the coronavirus. Because we have seen it that there are people who are healthy, and so coronavirus led to the COVID-19, and some of those people have died. Okay, I just want to put that disclaimer out there.
Doctor Nyamisha, Pama, for last one count. Name said, when my two mama okra dehydrated. Doctor, we say dear, because somebody wake up while rapping in my I want to join let's come as I have Minia Patrick Kako. I go see a crying, Minia Baba Coupe, Mabna, also Yami H. Doctor, I say it seems there from the story of my earlier. No, it seems that the Yariane to me older people no a chain younger ones no say the Nakas will be a D90 Yaman neba arm and it is over my the rate no, it look like say almost old age no a more chain younger no if say it's not mistaken.
Okay, so I want to make this thing clear. In Kuffour, we're free coronavirus no. They are more between the age of 45 to 64.
Wow.
So it's not the older people. It is 45 to 64. And to keep in mind, it said that's a wide range.
Yes.
45 to 64. All more we penny 40 years, a lot of them have passed away. But the range in the party of 45 to 64. So do not be fooled. Papa ne di enchira wa ma ababa wa na anko anko hwe ne papa ne say. Of course, the papa na nyini. Ababa wa ne young, but still no person be exposed the papa to any disease. I of course the papa the problem. Into the wa ma na anko hono no. I just want to put this in your mind to say it doesn't only affect people who are over the age of 65, but it has actually been affecting more people between the ages of 45 to 64. Or probably under the age of 18 or crown. Even when you're COVID-19. It's just something I want to put out there.
Wow, Doctor.
This information is coming from the CDC.
Yeah. Dr. Mbachaya Morif, in the test was a link in a gas or the Bema for
Masenyo.
health.
Teacher Pastor Masenyo.
When you know, fearful, Doctor, my hair cry.
I think that, bro, 2 attachments.
Oh,
okay. Baku tells you 10 things you can do to manage the COVID-19. And at the other one, no. COVID-19 with the website. Yes,
Masendia, bro. You're right. Auntie, your website to one way. I'm on for Etimahe. Doctor, you're according to where Major Manu wrap up on my abundance. So, wrap up my so far, the Koma Yedin Nana. Let's come, especially me about Kusia. Now, when you're being say, and now I late more. Whenever consume vino crowd, I late. It's doctor, I mean, your man wrap up mine.
Yo. And since they say COVID-19, the entire world, there are over 2 million cases, more than 2 million cases. America had here, there were over 690,000 cases. They are sure that the numbers are probably changing as I speak. Over NIPA 35,000 and over NIPA 50,000 now recover. As a matter of fact, Mount Sinai Hospital in New York, NIPA Bay 3,500 and over recover Omukofi. Human coronavirus, the entire friend of corona, it has that corona in front of it. They say virus, who as a crown, as a hinge, a crown. So I spikes, but a crown with spikes the day. It was shown to our friend of corona, normal virus. There were 4 main types of grouping of coronavirus. Your friend is saying 229E, and know your alpha coronavirus, and know your common human coronavirus. I make out what them. You were 229E, and know your alpha. You were NL63, and know your alpha coronavirus. You were OC43, and know your beta, and you were HKU1, and know your beta coronavirus. Other human coronavirus are Middle East respiratory syndrome, I friend in MERS, MERS coronavirus. Yes, I was SARS coronavirus also so honorable. And no, you just SARS-CoV. And there was SARS coronavirus 2. And no any coronavirus, a novel coronavirus now. Of course, COVID-19 a can't watch the same. Now, you were a more coronavirus to me a day, infecting nipa. Say infecting nipa, not about the human coronavirus. In the example, any 2019, yes, friend is saying coronavirus, any SARS coronavirus, any MERS coronavirus. Now, coronavirus is very deadly. It takes up immune system, it takes over with proteins. Now, me use two examples. I have to see air. Then if a frank over Boamu do Mufi and one air channel, or bad a bit turning off sprinklers. No, not I extinguish the war in our son was tuning in every. Was I see kerosene a fair way, Janitor? Now say Janet say a dairy more. And noon to will be air affected air inflicted with COVID-19 now. It to me take it over with lungs, and that's our brain, with lungs are affected, with liver. Your friend is saying will heart. And now they think is that your kidneys may even be affected. That's how deadly it is, coronavirus. So the over 334 clinical trials or more year. Our more year and for between a vaccine and near drew and so nipa betuma day between a bois. Or who say nipa be bro home coronavirus. But who say some of them have been reinfected with the coronavirus. So they are working on it to find out. I say so more year test to check for antibodies for all more when you coronavirus no matter survive, to check for antibodies. So if they find out if they built antibodies, that means they have immunity. Into which we use more plasma for research to find vaccines and drugs that with the coronavirus. Listen to what the scientists and the healthcare practitioners are telling you. The politicians, yes, it's all well and good that politicians can't say, but scientists or any healthcare practitioners know. Woman now what's our knowledge, Did you more canon a see now but so more because research or more a better answer a vaccine and I drop out. This may be 2021. Earliest, maybe in the first month or second month, because it takes a long time to do clinical trials, and even for the FDA to approve a drug, it takes quite a long time. And therefore, from a person who say, now, Dr. Akai said, could take care of yourself, making sure that we quarantine who are one room by itself. That's what we use when we are cleaning. So the next person coming, pick up BB away there, what they work on no more. We be used to different utensils, into we use disposable utensils, and money for call. If I call about one and one move your small from the bus, if I could be free dying or them now bar one tia, and was so a shame mask. Make sure with the proper way to put on your gloves and to take on your gloves, the proper way to put on a mask and take off your mask. We bet to me a payment to my mask now, they say, where you see elastic band there, I get the ashe. We mask now. Pull off the elastic band. Don't hold the mask in the front. I say, Fabria, you have to go to work because you're essential workers, Ube Drufia one time, you pass a plastic bag, which train after 3 days. No, we see we are. We're washing my scene, cleaning, disinfecting, and son, why they waste near my regular room. Moon disinfecting, we see, moon cleaning, we see, moon prepare, more doorknobs, more surfaces, and the idea. So we need a regular disinfectant, which we use Clorox. About a quarter cup of Clorox, 3 cups of water. Now with the semina kakra and so I would be a good spray bottle more. No way you as you're disinfected around the house, which means where you use Dettol and also the issue kakra one, which means you use as a disinfectant. Let's and say protecting your home because the area where you're deadly. Although a lot of people have recovered, still the problem is there will be a while or show any symptoms. Then so know a carrier of coronavirus. So which be the amount will be for and which no saying so wear a mask to protect yourself because you don't know who has it. Into one protect one and no one from your fire arena. Madame was sipping with the Yamijam. The best to us to be.
Yo, Doctor, Yami in shop and one my insura. Doctor, I in my yinti, me charm my boy, you know, me pitch and your man, Doctor, the Maya no eguso, no more your time, Ashebi. Said a bear also on me say, Bibia, eti time kuchu, may they toss no when your time, not also one the doctor can't want some.
In a copy, a giant in your son, as soon as you, as to Saubamua, a bet to my ear, and Tisani Okana, my son.
I saw here on Facebook, here on YouTube, and I said, Hope for Life, your website, more than gonna be out here free beer. I did a doctor, I can't want some, and it doesn't was in my COVID MD. And I made it at Tosono, and your time natural, so we'll be trying to picture 2 so we're in the not Odi, and so we have the next one, and so Eba, a few minutes. Mini set Oche, I've been over joining way late.
Obamera, Dinchaya, and you once, Obe freeze through now what ye. What's I assassin, we are it in a garaman in a resufre. Yes, I found in a resufre. Yeah,
you're sure when you're up on the next one, so I see the 10 things you can do to manage your COVID-19 symptoms at home and also not made it abana. A quite a first of managing a fear COVID-19 no 10 things no and a doctor Eddie brain.
dear, we are more broke for any other for.
The other one is also a free app. A free app that Safety Connect. And then I can want some so app in the dash. No.
Tell you why I resign, son of a gun, I swear. You're free, so. I said, one more, I do my acquaintance to Jenny. It's so for some rabbit. Now, who told a bit my GFs? How you? Yeah, Corona.
Your doctor, so far, dear media, so ama obia huntu wa wenya no betima go back. Timini our last message be at the man sana.
Yo, into the American say a woman's coronavirus is a couple, but there's somebody else and say, oh, young couple that society. Well, Becca, your own work here. So, through all these trials, these challenges, these unprecedented times, the American one is protection. Yes, someone share mask for Quabontia. Mr. Bobadiana said mask, wouldn't be for handkerchief and after fun to maybe teach one. No, Bobadiana also share gloves. Now we are wearing gloves and watch me. We best be a who will start disinfecting with fear and the idea when Papa will share Quabontia. Mr. and family now will fear a day with them, it will see. We drew open annual row on Pabua, now making sure they be our rubber bag the audience Pabuana chim. Now we drew there one pair from Pabuana who you know the good rubber bag, so I'm not dry. And from Pabuana will call them. The beer will be a bit protected with Mr. Momodi and Amonia. Most of more market one, Momodi and some more rubber man inside, more protected woman said you're very almost in your inquiry. Meaning the coronavirus, there causes a lot of anxiety, stress, depression, any uncertainty. But I'll be a brow between you a bushy day, a bondi be brave. More Monquamo Tiano, Mr. Mon connected with family and friends through media. Say, be I will be to be connected with will be via Zoom. And I say your friend is saying FaceTime and after Skype and also Boabi Bree. I feel so cautious. I'm a mamma. WhatsApp University now, why you don't want Aqua roller or more attending the Mr. Mosabrino, one country school, Mr. Way school, and some of WhatsApp University can and yellow queer. Won't hear the scientists on the healthcare providers they catch them on. Within Yamijamu, we will get through this. Within Yamijamu, you better she'll be.
Dr. Nyamisrop, Minister, when you cry, WhatsApp University in India, when ya, and Dr. C. Why Rolia, Quadusika, necessity WhatsApp, no. Aha, the watch say your WhatsApp, and you're careful with that, and you're sending in Anna, a true, a honor, near state to the medical professionals, a catching. Dr. Nyamisrop, also in your bread, and my enumerate, minimum for you, Edawasi, Nyamisrop, Nsinyamia Dumana, Christiane. Your best sign Asia.
Amen.
You're here for a Hope for Life Radio no Asugusua with you know COVID-19 and then Dr. Vera Kuffour Manu and your dean come say COVID-19. What have you learned so far? And then you see free mo a buy a tete more a unipani baby free or a boakiti we crowd won't mean for a new one. Microscope crumble, I think they difficult. And I wiping the passer and you're careful. What church and your mobile brave, or my apps, or mine dear, you hear beer, you bet me, I a bed boy, not uncle or how be arm rain. Yes, your home, young prepare said a bear, a bed boy, na your home answer. Corona no, a bamba, and your mobile brave, a hagany. It is a new missing one thing can. Na you and your health, you may dear the Brum Sundays, Biano, and her and your DBC, Genia Ampon, on Lucy Corona.
So we are baby at Obasio. If you see him, they do Donina, where would I do it? As I say, I just see you. So we are baby at Obasio, better from. If you see him, they do Donina, where would I do it? When this I got to surround director, now how bloody woman and master, then someone from his young Papa, a very many dear. Sakatira surround director, now how bloody woman and master, then someone from his young Papa, a very many dear. I'm very dear, was someone can also, yeah, so. We can break a fade and for us, already. nyangu boni wa avedia usuni wakakra musisha demo mumpye mrabanti sese ana mumeka mabusu samunoi ai samusi wa nyangu boni wa avedia shakine wakakra musisha demo mumrabanti sese ana mumeka mabusu samunoi Najanimia muframisa nyangu boni ave manidie wa hini Najanimia muframisa nyangu boni ave manidie wa hini Ebirina turusui Ako kasi abaza sisu na nyadiane komo mama radia zamuti emukom Ebirina turusui China fosori awasi Buddha India fosori awasi Hindu Afe dabani na nduru mumfire mabusu muwonwe India fosori awasi Hindu Na China fosori awasi Buddha Afe dabani na panu umfire mabusu muwonwe Afa usofu wa mundikasi ya mwenyadi yetu muwono Afa konfu wa mutiti bisu wa mujamanu wono She coronavirus na bano Nungo pe solution mle ya sinyina Na ye wulu se You are so powerful Afa usofu wa mundidomu tumu Wasamu na muwa dom bebere wo maimuno Umbiye mera bante Umera meya soli na yenje Coronavirus nti Ememe nyina yemma Coronavirus nti Azafu nyina yekom Ego mwakasi ya bibaza zisu Nanye diani komu Radia samu komu Biri na duo Nyame mamu mampayo Erade kanu wati amanyina yekum Erade kanu waseki ni uamavya sinyina usoyo nyangu ponti musono Samoshana ni monyamda Sajanimio Najanimia Muframisa nyangu poa Ave manidie wani Esaba monyanu wadro Ibola ba monyanu wadro Afe coronavirus na banu wa Kristo fa jimba ibo Pati Esaba yenyanu wadro Ibola ba yenyanu wadro Afe coronavirus na banu wa Kristo fa jimba ibongoa Abu onyangu panu masam na mudiwi asinchecheni antai na muna musuzuze Mubefa muwediana Endi za janimia Muframisa nyangu poma Afe imani diyewa Usura nyangu poma Janimia Muframisa nyangu poma Afe imani diyewa
Obeba, mamenya uto.
bien pana ya reka masadami. Dale intima do fumbo umidane. Ah, pisa mi bana mi wanso. Misi mi bana mi wanai. Yeah, mi bana mi weni. Dale inti anashani nina shrimmerade. Yeah, nasasanya yasa. For Jehovah, because I'm a man out. Oh, me a retina. If my money wouldn't see that. There is a phone in your so me crap party sit time ubwa sana odi ejugwa achinya mi mani di esikaninu sasem yini marechichi semti mitafuma weni nyi mamani wai na mi yare no ntrese masei enyame no ntrese mi nyini pawai nyame kwane ti mi sisa shebre Mini so betu mi afisa mamani enzo me yarenti ya mususu ojome mamani unti ya mususu ntitime na yaresa foni Israel yami o obeka sama menya unto yami yarenti na ipamesi mamani ununtina ipamesi yaresa foni nyami obeba mamenya unto no nebi so sere kobe ya le da bezana subatu every said yes I watch ya onya ya resafo ese wa bre onya kama phobia Yesu Kristo sanu ya rebe osene safa ogetenante balasi forte asemya wati kokum waja wahwe sawa so kete umida etiza na safa said, Daniel,